Assalamu alaikum everyone. Bismillahirrahmanirrahim. Quote of the day: all things are difficult before they are easy. I am Dr. Alishba Rasool, PGR Community Medicine, and I will be presenting noise under the kind supervision of Professor Dr. Saira Afzal. Learning outlines: what is noise? What is noise pollution? Sources of noise, types of noise, auditory and non-auditory effects of noise, prevention and control, WHO guidelines of noise management, recent updates and MCQs. Learning outcome: at the end of the presentation, participants would be able to describe the effects of noise pollution, its prevention and control. Definition: noise is commonly called an unwanted sound, but this definition is subjective because a sound that seems unwanted to someone may be pleasant to another person. Noise is defined as a wrong sound in the wrong place at the wrong time. What is noise pollution? Sound that is unwanted or disrupts one's quality of life is called as noise. When there's a lot of noise in the environment, it is termed as noise pollution. Sound becomes undesirable when it disturbs the normal activities such as working, sleeping, and during conversations. It is an underrated environmental problem because of the fact that we can't see, smell, or taste it. World Health Organization stated that noise must be recognized as a major threat to the human well-being. The World Health Organization defines noise above 65 decibels as noise pollution. To be precise, noise becomes harmful when it exceeds 75 decibels and is painful above 120 decibels. As a consequence, it is recommended noise levels be kept below 65 decibels during the day and indicates that restful sleep is impossible with nighttime ambient noise levels in excess of 30 decibels. Common sources of noise pollution: airplanes and airports, traffic and mass transit, amplified or piped in music, construction and industrial activity, lawn and garden equipment, emergency vehicles. Types of noise pollution on the basis of sources: noise pollution by transport, noise comes from road and traffic, noise pollution by neighbors, unwanted noise comes from our neighbors, noise pollution by industries, noise comes from the process of urbanization, manufacturing, developments, etc. On the basis of frequency, continuous noise, it comes continuously from factory equipment, engines, heating, and ventilation systems. Intermittent noise. Level of intermittent noise increases and decreases rapidly caused by a train passing by, factory equipment, or aircraft, etc. Impulsive noise. This is the noise of the construction and demolition industries. Low frequency noise. It is low background noise, comes from a nearby power station or the roaring of the large diesel engines, etc. Properties: loudness or intensity, frequency. Loudness refers to the intensity of the noise, which depends upon the amplitude of the vibration that initiated the noise. The loudness of noise is measured in decibels. Normal conversation noise 60 to 65 decibel, whispering 20 to 30 decibel, heavy street traffic 60 to 30 decibel, motor car horn 120 decibels, boiler factories 120 decibel. A daily exposure that an individual can tolerate without damage to the air is 85 decibels. Speech, two to three people, 73 decibels. Speech on radio, 80 decibels. Music on radio, 85 decibels. Children shouting, 79 decibels. Children crying, 80 decibel. Vacuum cleaner, 76. Piano, 86. Jet takeoff, 150. Acceptable noise levels. Residential, 25 decibel. Living room, 40 decibel. Commercial office, 35 to 45 decibels. Restaurant, 40 to 60 decibel. Industrial workshop, 40 to 60 decibel. Educational classroom 30 to 40 decibel, hospital wards 20 to 35 decibel. This is denoted by as hertz. Human ear can hear frequencies from about 20 to 20,000 hertz, but this range is reduced with age and other subjective factors. The range of vibrations below 20 hertz are infraaudible and those above are ultrasonic. Some animals can hear sound that are inaudible to the man. Instruments for measuring noise: sound level meter measures the intensity of sound in decibel, octave band frequency analyzer measures the noise in octave bands, audiometer measures hearing ability. Effects of noise exposure: auditory effects and non-auditory effects. Auditory effects: auditory fatigue occur in 90 decibels and at 4,000 hertz associated with whistling and buzzing in the ear. Deafness, hearing loss This is a serious pathological effect. The individual involved may not be aware at the early age. Deafness may be temporary or permanent. In temporary, disability appears 24 hours after exposure to the noise, commonly occur at frequency range of 4,000 to 6,000 Hz. Continued exposure to noise at 100 decibel can result in permanent deafness. Exposure to noise at 160 decibel may rupture the tympanic membrane and cause permanent deafness. Auditory effects of noise: per stimulation, fatigue, or adaptation, noise exposure of greater than 90 decibel elevates hearing threshold temporarily, especially at 4 kilohertz. Post-stimulatory fatigue, temporary threshold shift, and permanent threshold shift. The non-auditory effects: interference with speech at 300 to 500 hertz range, annoyance. This is primarily a psychological response. Neurotic people are more sensitive to sound. Efficiency: where mental concentration is desired, noise may reduce work output. Physiological changes: rise in BP, rise in intracranial pressure, increase in heart rate, increase in breathing rate, increase in sweating, giddiness, nausea and vomiting, sleeplessness, narrowing of pupils. Economic losses: cost of noise induced hearing loss to industry is great. Non-auditory effects of noise: insomnia, anxiety and nervousness, coronary heart disease, lack of concentration, fatigue, irritability, and impatience. Indigestion, peptic ulcer, speech interference, hypertension, increased heart rate, increased intracranial tension, increased breathing rate, increased sweating, decreased color perception, decreased night vision. Prevention of noise pollution: do not use car horns unnecessarily. Areas like hospital and campuses are silent zones and horning is prohibited there. Motor machines and vehicles also produce loud noises when not maintained properly. Proper maintenance should be carried out for better performance. Turn off the engine of your car or motorbike when you're not using it. It stops the annoying humming and reduces air pollution also. If you're working in an area where there are loud noises, you must wear earplugs to prevent loss of hearing. Trim bushes or shrubs by hand. Don't use a noisy bush trimmer. Don't blast music on the radio or computer or speakers. Be considerate of your own ears and those of the other around you. Train your dog not to bark so much. Do noisy things, etc., over or on a rubber mat to reduce noise. How to control noise: careful planning of cities, control of vehicles to improve the acoustic insulation of building. Industries and railway must be situated away from the residential areas. Protection of exposed persons through use of personal protective equipment, legislation, education. Careful planning of cities. In planning cities, the following measures should be taken to reduce noise: division of the city into zones with separation of areas concerned with industry and transport, separation of the residential areas from the main streets by means of wide green belts. House house front should not lie less than 15 meters from the road, and the intervening space should be thickly planted with trees and bushes. Widening of the main streets to reduce the level of noise pollution into dwellings. Control of vehicles. Heavy vehicles should not be routed into narrow streets. Vehicular traffic on residential streets should be reduced. Indiscriminate blowing of the horn and the use of pleasure horn should be prohibited. To improve acoustic insulation of the building, the best arrangement is construction of detached buildings rather than a single large building or one that is continuous. Installations that produce noise or disrupt the occupants within dwellings should be prohibited. Buildings should be soundproof where necessary. Industries and railways. Control of noise at sources possible in industries. Special areas must be earmarked outside residential areas for industries, for railways, and similar installations. When these demands are not met, protective green belts must be laid down between the installations and residential areas. Protection of exposed persons. Hearing protection recommended for individuals who are continuously exposed to noise louder than 85 decibel in the frequency bands above 150 Hz. Workers must be regularly rotated from the noisy areas to comparatively quiet posts in factories. Periodical audiogram checkups and use of earplugs, earmuffs are also essential as a situation demands. Legislation. Many states have adopted legislation providing control which are applicable to wide variety of sources. Workers have right to claim compensation if they have suffered a loss of ability to understand speech. Education, a no noise abatement program can succeed without people's participation. Therefore, their education through all available media is needed to highlight the importance of noise as community hazard. Guidelines for community noise. Specific environment, outdoor living areas, critical health effects, serious annoyance, daytime, evening, moderate annoyance, daytime and evening. The fundamental goals of the noise management are to develop criteria for deriving safe noise exposure levels and to promote noise assessment and control as part of environment health programs. These basic goals should guide both international and national policies for noise management. A legal framework is needed to provide a context for noise management. National noise standards can usually be based on a consideration of international guidelines, such as these guidelines for community noise, as well as national criteria documents, which consider dose response relationships for the effects of noise on human health. Other components of a noise management plan include noise level monitoring, noise exposure mapping, exposure modeling, noise control approaches such as mitigation and precautionary measures, and evaluation of control options. Now it's time for the recent updates. Assessment of noise pollution and its effect on the human health in industrial hub of Pakistan. Faisalabad is one of the major industrial cities of Pakistan, which may cause noise pollution to the local residents due to development of robust industrial and transport system. The study aimed at mapping the noise pollution levels at various locations of Faisalabad, comparing noise pollution levels in the morning, the afternoon, and the evening for each source, assessing non-auditory effects of noise on human health. Two industries and 43 busy locations of Faisalabad were selected to study noise pollution by using the sound level meter for the period of 24 hours. Questionnaire-based survey was carried out near the sampling points to get a public perception about the health impacts of noise pollution. The measured equivalent sound pressure levels were higher than the permissible limits at all the sampling locations during morning, afternoon, and evening hours. The maximum sound pressure level was 102 decibel inside the production unit in the afternoon at Mia Muhammad Siddiq Textile Loom Industry. The average SPL was found at State Bank Road, Children's Hospital, Jhang Bazaar in the afternoon, and at Punjab Medical College in the evening. Based on the survey, 94% of the respondents reported headache, 76% sleeplessness, 74% hypertension, and 74% psychological stress, 64% elevated blood pressure, and 60% dizziness. Noise pollution is higher than the standard limits and causes auditory as well as non-auditory effects on humans. The vehicles and industrial machines should be maintained, and sound proofing and protection equipment should be provided to the workforce in order to protect them from extreme noise level. The loudest cities in the world. The World Health Organization suggests that healthy noise levels should not surpass 55 decibels during the day and 40 at night. Going beyond these threshold values can pose a serious health risk to those in the near vicinity of the noise. The article examines the noise levels in the metropolitans around the world. Number 1 was Mumbai, India. Number 2, Cairo, Egypt. 3, New York, United States. 4, Delhi, India. 5, Tokyo, Japan. 6 was the Gary, Argentina. 7, Shanghai, China. And 8 was the Karachi, Pakistan. Excessive noise pollution in Lahore rings alarm. Lahore, the noise pollution level has crossed the World Health Organization's acceptable threshold of 60 to 65 decibel in various areas of Lahore as well as across the province. As the Punjab Environment Protection Department, City District Government, Traffic Police, and other departments concerned fail to alleviate the levels of pollutant from the atmosphere. Residents of various areas in Lahore, particularly dense residential and commercial areas, have suffered owing to the escalating noise pollution levels. In the past, the government had taken an initiative to reduce the sound pressure by declaring Jail Road as the silent zone, 50 decibel sound pressure limit, but the campaign failed as no one was willing to abide by the law. The doctor asserted the most patients suffering from hearing issues, stress, and depression hail from areas where noise pollution is more compared to the others. Noise pollution and unwarranted menace for urban Pakistan. Noise levels in Pakistan have reached critical levels with average noise values of 76.5 decibel being recorded in Karachi, 72.5 in Islamabad, 86 in Peshawar. While these values may not have reached astronomical levels, but if left unchecked, it could cause widespread hearing defects, insomnia, indigestion, heartburn, ulcers, hypertension, and psychological disorders. According to WHO criteria, noise levels in residential areas should be 45 decibel, 55 decibel in commercial areas and 65 in the industrial areas. Note that these are the maximum levels, and yet in our major cities, the value is at least 10 to 20 decibel above WHO criteria. There's a dire need for legislation to control increasing noise pollution inside the city. Pressure horns and loudspeakers should be completely banned. Industrial areas, airports, and highways should be located outside the city limits for public awareness. Television, radio, internet, and newspapers should run campaigns for wide publicity. Now it's time for the multiple choice questions, and I would like everyone to actively participate in this session. World Health Organization considers noise as a major threat to human beings. At what level WHO considers it as noise pollution? A, above 65 decibel, B, above 85, C, above 70, D, above 120, or is it E, above 130?
C.
It's A, above 65. The house was being constructed after demolish of the old building just adjacent to Mr. Ali's residency. He and his family got irritated due to ongoing prolonged noise and planned to move to some other low noise area temporarily. Which type of noise is this? A, impulsive, B, continuous, C, low frequency, D, intermittent, E, high frequency.
E.
It's A, impulsive. The traffic warden has been doing his job on different areas of a very busy city, XYZ, for the last 5 years. He now presented an ENT OPD with a complaint of difficulty in speech, a daily exposure that an individual can tolerate without damage to the ear is A, 65, B, 100, C, 120, D, 85, or is it E, 56?
It's C.
D.
Yes, D is the right answer. You are an occupational hygienist who has been tasked with addressing a potential noise hazard for workers. Using your dosimeter as a measuring tool, which decibel reading would indicate a hazardous noise level? A, 70, B, 58, C, 22, D, 115, or is it E, 456?
It's D.
Yes, D is the right answer. The government brought awareness in the public by educating them through media about the importance of noise pollution as a health hazard. What disease could be caused by noise pollution? A, asthma, B, brain tumor, C, child development, D, blindness, E, lung tumor.
C.
Yes, C is the right answer. A family is residing in a close proximity to a factory. One of the members with a history of schizophrenia is very much prone to develop dash due to high noise throughout the day. A, sleep disturbance, B, annoyance, C, diabetes, D, hypertension, or is it E, CLD?
It's A.
A.
Sleep disturbance.
A.
Yes, it's the right answer. An employer ABC working at aircraft maintenance site of a busy international airport is now complaining of ringing in the ears. He visited ENT consultant who told him that he was suffering from auditory fatigue. How can noise exposure be reduced in a workplace? A, by immediately issuing personal protective equipment to the workers, by allowing users to listen to music while working, by having more than one user do an activity so it's done quicker, by implementing a job rotation system, or is it E, by reducing his work hours?
It's A.
D, by
A.
implementing a job rotation system. The bomb exploded, producing a sound of around 160 decibel, where a few nearby residents developed hearing loss. Which of the following auditory effects they developed? A, auditory fatigue, B, post-stimulatory fatigue, C, temporary threshold shift, D, permanent threshold shift, or is it E, pre-stimulatory fatigue?
C.
C.
It's D, permanent threshold shift.
D.
One of the side effects of noise pollution is auditory fatigue, in which a sufferer complains of whistling and ringing in ears. At what decibel and frequency does it appear? A, 90 and 4 kilohertz, B, 120 and 40 kilohertz, C, 90 and 2 kilohertz, D, 80 and 4 kilohertz, or is it E, 70 and 4 kilohertz?
It's A.
Yes, A is the right answer.
A.
Mr. Salim was working in an industry where noise pollution caused hearing loss to him. He is living in a country where the government has developed legislation for noise control and management. Now, what can he do? He can claim for his compensation. He can seek treatment on his own expenses. He can be fired out from his job and replaced by his son. He cannot take financial help from the company. E, he can find another job.
It's A is claim compensation.
Yes, it's the right answer. This is the key of the MCQs. These are the references. Thank you everyone for your kind and patiently listening.
Thank you very much, Dr. Alishba. Very nice presentation, and especially the part of the recent advances that was wonderful. I really like your presentation style and how you have given such an important piece of information. Very well done, and thank you everyone for joining today. Thank you.
Thank you, madam. Allah Hafiz.
Thank you, ma'am. Khuda
Allah
Hafiz.
Hafiz.
Thank you, ma'am. Allah Hafiz.